Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for May 19th, 2020. Just wanted to let you know that this evening our second round of regional health town halls will take place. Tonight it will be with on Vancouver Island. Liberal health critic Norm Letnick will be there, along with Ronna Ray Leonard, the MLA for the Comox Valley, Kathy McNeil, the President and CEO of Island Health, and Dr. Richard Stanwyck, the Chief Medical Health Officer. On Friday, May 22nd, there will be a town hall, virtual town hall in Fraser Health, Bob Deeth, MLA, Joan Isaacs, MLA, Dr. Victoria Lee, the President and CEO, and Martin Lavoie, the Chief Medical Health Officer, Dr. Martin Lavoie. Well, also tomorrow, the Minister of Education, Rob Fleming, will be joined by BC School Trustees Association President Stephanie Higginson to have a town hall. All of those town halls are at 7:15. Tomorrow, there won't be any briefing in person tomorrow. There'll be a written briefing tomorrow at 3 o'clock with tomorrow's case numbers, and Dr. Henry and I will be returning here on Thursday at 3 o'clock. And with that, I'm happy to introduce Dr. Bonnie Henry. But before I do that, I just wanted to note that we're here on the traditional territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Dr. Henry.
Thank you and good afternoon. I'm happy to report today that we have 2 new cases of COVID-19 who have tested positive here in the province in the last day, bringing our total to 2,446 people in British Columbia who have tested positive. That includes 883 people in the Vancouver Coastal Health Region, 1,196 people who reside in the Fraser Health Region, 126 people in the Vancouver Island Health Region, 181 in the Interior Health Region, and 60 people in the Northern Health Region. We continue, as people are aware, to have active outbreaks in our healthcare system, including 14 in long-term care or assisted living and 5 that are ongoing in our acute care system. There are no new outbreaks, and we have only 1 additional case in those outbreaks, bringing our total to 326 residents who have been affected and 203 staff. As well, we have no new community outbreaks to report, and the ones that we have been following continue. We have right now 325 active cases around the province, and of those 45 people are hospitalized, including 12 who are in critical care or ICU. On a sad note, we have 3 additional people who have died from COVID-19 in the past day, bringing our total number of people who have died to 146. So that includes 1 in Vancouver Coastal Health and 2 people in Fraser Health, all of whom were people in our long-term care system. And our condolences go to their families and to their loved ones and to their care providers. We now have 1,975 people who are fully recovered from COVID-19. As people in BC are no doubt aware, today is an important milestone for our province. Today is the first day that many businesses can begin to reopen. For employees, customers, and business owners, I want to reassure you that we would not be easing these restrictions if we did not feel we could do so safely. And we have been talking about that for some time, how important it is that we continue to monitor people who are showing symptoms across the province, the outbreaks that we are continuing to manage. And we will be and will continue to do this in public health. Protecting everybody in British Columbia is and will remain our number 1 priority. But we can do this, and we will do it slowly and thoughtfully together. We can flatten our curve and safely reopen our province. But we must take it slowly. Just like the BC Restart Plan that we talked about a little over a week and a half ago, being thoughtful and cautious is how we need to proceed in the coming weeks. The approach will give you, your employees, your customers, and all of us the confidence that we need that we're doing all we can to keep people safe. I also remind businesses that they need to follow the guidelines provided by WorkSafe BC in concert with public health, and that we need to have a COVID-19 safety plan in place. And this is a way of us all being explicit about the things, the measures that we are doing to protect our businesses, our employees, and our customers. As we know, the WorkSafe BC and the public health guidance is now available for many different sectors, and the work is ongoing, and more will be available in the coming days. We're working on that now. A lot of consideration has gone into this, and the guidance really balances the need to be practical and sensible and safe by allowing businesses as well to adapt the guidance to their own situation and their own employees, their own facilities. I encourage you all to do the same, to assess the risks, to determine if you can safely reopen your business, and take the time that you need to do that. Put the precautions in place and be safe. You can, of course, talk with your local public health, in particular the environmental health officers who are very good at this. This is the work that they do to support you in this, and to talk to WorkSafe BC. And then your first call is WorkSafe BC 1-888-621-7233, and there is a hotline there where you can get information and to help you interpret your specific needs for your business. As well, if you are a regulated health professional, your regulatory college has guidelines for you that you can use to safely expand the activities and the services that you're providing in the community. So staying vigilant is even more important as we ease these restrictions and we start to interact again, both in our social interactions, but also in business. Every day, all of us must pause and think about how we're going to keep ourselves, our families, and our communities safe. Our individual circumstances are unique, but the actions we can take to protect each other and ourselves are the same. And that is the same things that we have been talking about for many months. Ensuring that we keep a safe physical distance, cleaning our hands regularly, covering our coughs and sneezes, making sure we don't touch our face, and incredibly importantly is staying home if we're feeling ill at all. Staying away from others is incredibly important. Simple things can make a big difference, but we need to go slowly. Keep those few faces and big spaces top of mind. Be aware of your location, the duration of time that you're going to be there, and who you're going to be with, and who is at home that you need to make sure that you're protecting. Wash your hands regularly. I have no doubt that we will get through this by working together and working out the kinks over the coming weeks, and by continuing what we have been doing all along, which is being kind and being calm and being safe.
Thank you very much, Dr. Henry, and I wanted to join you and the Premier and everyone in BC in passing on our condolences to the 3 people who have passed away in the last 24 hours from COVID-19 in BC, 2 living in the Fraser Health Authority and 1 in the Vancouver Coastal Health Authority. We know what a difficult time this is. That makes, of course, 146 people who've passed away from COVID-19 since the beginning of this pandemic, and it's obviously for all of us a very sad day every day when people pass away from COVID-19. So we want to express both our recognition of the sorrow of caregivers and of families and of friends, and also our recognition of the significance of the lives led and how much those people will be missed. As Dr. Henry has said, there are 2 new cases today, which is obviously in and of itself positive news. When you're testing and you're looking for cases and you only find 2, that's a very positive indication. That said, we still have 45 people in acute care and 12 in critical care. That's 21 in Fraser Health, 1 in Interior Health, 1 on Vancouver Island, 2 in Northern Health, and 20 in Vancouver Coastal Health. I note that we continue to see people returning and using emergency rooms, not to the extent they were prior to March the 9th. in that period, but still significantly. Again, yesterday, just under 4,975 people visited emergency rooms. One of the issues for people in visiting hospitals, of course, one of the reasons why that number dropped, even though we continued to provide healthcare services to under 3,000 at one point in April, was to a degree fear in a sense that people shouldn't go to the emergency room when they needed to go. And we have been, I think, pretty consistent in trying to ensure that that happens. And that's, of course, often a concern in the healthcare system for people with disabilities. We have, as everyone knows, a policy that strongly restricts visitation in both hospitals and long-term care to what are defined as essential visits. And that provides, and from the beginning, we provided hospital care teams direction on what type of visit is essential, including for patients nearing end of life, or visits to provide specific types of care for patients with unique needs. Policy is based on advice from the provincial health officer and her team to prevent the deadly spread of COVID-19 in BC hospitals, based on the experience, evidence, and data she has had, and everyone in the healthcare system has had in addressing pandemics in the past, or many in the BC health system have had. We are making a small revision to that policy today, a significant one, to make sure healthcare providers have clear guidance about the considerations they need to make when deciding whether a visit is essential. For example, they need to consider the importance of assistance for persons with disabilities who have special needs, such as feeding, mobility, communicating, or need assistance in decision-making. Those changes will be posted today, and they're significant changes for people. They came at the request and the concern of people in the disability community so that they would have the confidence to visit hospitals, and they're also, I think, will be helpful with our staff in making those important decisions around essential visits. And I just wanted to read the three specific considerations here that essential visits include assistance by designated representatives for people with disabilities, including provision of emotional support, visits for supported decision-making, and communications assistance for persons with hearing, visual, speech, cognitive, intellectual, or memory impairments. Those will be posted today, and I want to thank everybody, including people in the broader disability community, who provided us support and advice in making those additions, that new guidance to the essential visits policy. On Tuesday, we provided an update on the PPE that we've received over the past week. To recap, cumulatively, in past weeks, I've announced that the following PPE has arrived in BC since the beginning of April. Approximately 4 million N95 respirators. 63,000 of those are from the federal government's bulk procurement. 3.5 million surgical masks, that's 146,000 from the federal government's bulk procurement. Over 1 million pieces of eye protection. 212,000 of these are face shields from the federal government's bulk procurement. Approximately 11 million pairs of gloves. 440,000 of these are from the federal government's bulk procurement, and close to 1 million gowns. Today, I can tell you that since last Tuesday, we've received 14,730 N95 respirators, 786,155 surgical masks, 15 million pairs of gloves, 265,000 pieces of eye protection, and 320,000 more gowns. As always, any product that we've received that isn't from a trusted, reliable vendor will be subject to assessment and testing before it gets into the health system. This also includes masks and respirators received from the federal government, as well as donations. Just wanted to update you. As you know, yesterday we resumed non-urgent scheduled surgeries in addition to the urgent and emergency surgeries that continued under our initial response to COVID-19. We announced this policy on May the 7th, and I've worked over the past week with patients, calling them to see if they're comfortable coming in for their surgeries, as well as to book non-urgent scheduled surgeries. All health authorities have now started non-urgent cases, all 6, including the Provincial Health Services Authority and the 5 other health authorities. They're performing them currently as of May 19th at 49 sites. 16 sites in IHA, 11 in Fraser Health, 2 in Vancouver Coastal Health, 8 in Vancouver Island Health, 9 in the Northern Health Authority, and 3 in the Provincial Health Services Authority. We will be reporting on estimated numbers of non-urgent surgeries to be completed this week in the coming days. along with the calls that have been made and urgent and emergency surgeries completed in the past week. We know that it takes time to schedule patients, complete any preoperative testing, and even be reassessed by physicians. We also know that our hospitals have made changes to their staffing and in some cases physical spaces to respond to COVID. And of course, many sites are still responding to COVID with patients in their hospitals. That's why it'll take approximately a month to get back up to a near normal pre-COVID level of operating for scheduled surgeries. I wanted to thank everyone involved in this extraordinary process, extraordinary at both ends, extraordinary that during COVID-19, so many surgeries, urgent surgeries and emergency surgeries were done by nurses and doctors with the support of healthcare workers and health sciences professionals across BC, and extraordinary that we have managed to get the system back up and running for scheduled surgeries in the last little while. On January 21st, Dr. Henry and I issued our first statement on COVID-19. That's 17 weeks that have passed since then. 17 weeks. Weeks that saw COVID-19 arrive in BC, weeks that saw us launch our BC pandemic response, and weeks that changed everything in how we live our lives. And along the way, the people of BC stayed apart and worked together, and we bent our curve. Everyone in BC, all of you, made a difference. Starting today, much more is possible in social, surgical, and economic renewal than was the case just yesterday. Some businesses and services will open right away, others in a few days or weeks. Some of us will safely expand our contacts with businesses, services, and friends and family right away. Some of us will do so when we feel it's time, the right time for us, the safe time for us, given our unique circumstances. Phase 2 is here, and with it, the freedom to participate in renewal. Our individual comfort zones will dictate when we take advantage of the opportunities Phase 2 offers. And when we find our comfort zone with these enhanced contacts, when we have the confidence that they are right for us, then we safely participate in Phase 2. The one thing that hasn't changed, and this won't change for months, is our need to keep using the skills that Dr. Henry and medical health officers from across BC have taught us to stop the spread and to stay safe. These are the skills we must continue to use in the days and the weeks and the months to come. Today marks a key transition in our BC pandemic. No matter when and how we choose to participate in Phase 2, staying 100% all in the effort to stop the spread and keep us safe is essential to our continuing BC COVID-19 effort. Aujourd'hui, nous annonçons 2 nouveaux cas pour un total de 2446 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19, dont un dans le région de santé de Vancouver Coastal et 2 dans le région de santé de Fraser, pour un total de 146 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé de la Colombie-Britannique compte toujours des patients atteints de COVID-19. 883 se trouvent à Vancouver Coastal, 1196 à Fraser, 126 sur l'île de Vancouver, 181 dans l'intérieur et 60 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 45 personnes sont actuellement hospitalisées, dont 12 en soins intensifs. Thank you very much. Merci beaucoup.